three rules of masking, and I'm going to use audiogram to illustrate these rules. The first rule of masking has to do with air conduction testing, and this is it illustrated on an audiogram. Most of you who are watching this video will know what an audiogram looks like. This is air conduction on the right side and air conduction on the left side. If there's a difference between the air conduction of one ear and the other by 40 dB, you need to mask the good air, which means that you need to keep the good air active by giving it a sound. This isolates the air that you want to test. Now, if you're given this audiogram, it's possible that this ear has a 40 dB hearing loss, but it's also possible that this ear could be a dead ear. And the reason for this is when you give a sound to this ear at 40, it goes across to this ear, so it's perceived as a sound. So this may be a false reading. And the value 40 is what's known as the intraoral attenuation between the two ears. So we need to take this out of the equation and retest this to see whether this is real or whether it's way down here beyond the scope of the machine. And to get this true value, we need to apply masking. So the second rule of masking has to do with bone conduction testing. Remember we said the first rule, ear conduction testing. And this is the second rule of masking illustrated here. So you can see the air conduction on this side is given again at 0. But the air conduction here is, let's say 10 dB. And the unmasked bone conduction is at this level here. Now the triangle is a British symbol, which means unmasked, and it's relevant to both ears. Now if you present it with this audiogram in an exam, it's impossible to tell whether this ear has a conductive hearing loss or a sensory neural hearing loss, because the bone conduction is not masked. Yes? This needs to be masked to determine whether the hearing loss in this ear is conductive hearing loss or sensory neural hearing loss. Again, you will give a sound in this ear, it's through the canal, which is ear conduction masking. And you check back the bone conduction. There's two possibilities you could get. I'm going to illustrate it here. So this is what we have at the beginning. It can go in this direction. This is masked bone conduction on the left side. This is the symbol for it. If it's up here, then you know this is a conductive hearing loss on this in this ear. If it's like this, where it's next to the air conduction, it's sensory neural hearing loss. And this is the reason why you need to mask the bone conduction. Yes? So the second rule of masking is when there's a difference of 10 dB or more between the two ears, you need to mask the ear in order to find out whether there's a true bone conduction loss. The third rule of masking is probably the most difficult to understand, but I will make it very simple for you. It's actually an extension of the first rule, so it's dealing with ear conduction testing. And this is it illustrated on an audiogram. You can notice that on this side, the right side, the air conduction is not at 0. I'm going to put it at about 10. On the left side, we're given the air conduction as well as the unmasked bone conduction. Now, if we apply the first rule, which we stated before, was if the air conduction between the two ears is more than 40, we need to mask. But in this case, it's not more than 40. It's 10 and this is 40, so that's 30 dB. This means that based on the first rule, we can accept this as a true value. However, this ear may have a conductive hearing loss, and therefore it's given an artificial reading of this ear conduction because of the artificial gain. So the third rule has to do with bone conduction difference in one ear being more than 40. So if the bone conduction is greater than 40 between the ear, you need to mask because this ear has got an issue. And the issue is the good ear must have a conductive hearing loss. Okay, that's when you apply the third rule of masking. If there was no conductive hearing loss in this ear and this was on here, you would have applied the first rule. So for the third rule to be relevant, the good ear or the better ear must have a conductive hearing loss. And you're using the bone conduction to compare with the ear conduction in order to determine whether you need to mask. So masking in the third rule is when the bone conduction difference in the ear is more than 40. Eye bone conduction versus ear conduction more than 40, you need to mask that. So I'm going to summarize the 3 rules of masking in a simple triangle. If you ever get lost or forget the rules, you can apply this triangle and bring it back very quickly. So if the air conduction between one ear and the other ear is more than 40 dB, which is rule 1, you need to mask. If the bone conduction or mask between one ear and the other ear, or the same ear, is more than 10 dB, you need to mask, and that's the second rule. If the bone conduction between the ear is different from the ear conduction by more than 40, you also need to mask. So this triangle summarizes the 3 rules of masking.